Okay, everybody, this is Dr. Ed Park from Recharge Biomedical. We're going to do our first webinar on exosomes. And this will be a weekly thing at 11 a.m. We'll start more promptly next time as I've already figured out how to avoid the crazies, get everything working. So most of you know me. If you don't, I'll just tell you basically how we got here. It's a couple of interesting stories and then some self-experimentation. I went to Harvard undergrad and for residency. And then I also got my MD and my Master's of Public Health in Columbia in New York City. Since 2007, I had a friend who was starting a company in anti-aging, and they asked me to consult. So I knew that exosomes were very powerful, and I knew that this was the way that it was going to go in the future, not stem cells, as we'll discuss later, but exosomes. In 2018, at the A4M conference, I saw this guy with his arms folded, and he's actually a 64-year-old neurologist at UCLA. And he had laid down his motorcycle, broken like 7 ribs, fractured his ankle, so it's dangling by skin, his collarbone, and lost a third of his blood. And in response to that trauma, he snuck in 5 vials of exosomes into his IV. And within a month, he was on stage talking to an audience, he's fine. I don't know if anybody has had a bruise or fractured rib, but it hurts a lot even to breathe or laugh. So the fact that he bounced back really impressed me. And I had to say, well, if this guy's not lying, there's something to this. Duncan Ross is the owner and chief scientist at his company Chimera, which is where I get my exosomes from currently. And he was for many years trying to cure COPD. And one of his collaborators was a doctor whose wife had COPD, and he tried to get her cells to copy, but copy they would not. Until he took the broth from the stem cells of a young paraplegic and put it in with the older woman. As a result, she got herself to replicate quite a bit. So what we see on the bottom right is in the same year that he realized it wasn't the cells that were the problem, it was the lack of the right signals from the exosomes. His friend threw water on a fire and burned his face in the 3rd degree. What you can see in that picture is this African-American gentleman had a burn, and where it was burned and where they applied exosomes, it came back younger than ever. So the epiphany was from both the old ladies whose cells wouldn't copy and from his friend with the burn is that you need the young exosomes. And more importantly, our old cells can still respond to young exosomes. So my story, as many of you know, I started taking a telomerase activator 13 years ago. And since then, I lost weight, my gray hair went away. I'm 53 now, I don't use reading glasses, I can use this close. Whereas 13 years ago, I did have all that. So over the course of the years, I've been talking about my patients and their experience with telomerase activators, which is one aspect of aging, where our telomeres shorten and our stem cells get damaged. So I wrote 2 books on this. One is called Telomere Time Bombs, and you can purchase that. The second book was commissioned by Hay House in 2018. It's no longer in print, but you can get it on Kindle. It's more like a handbook for people how to stay young naturally. So I take the science of how people are staying young, telomerase activity, telomere-wise, and apply it to breathing, mindset, sleep, exercise, diet, supplements. So after I saw Sheldon Jordan on stage, I said, well, maybe I should try this. I have a bad shoulder, my knee, meniscus has an old injury, my Achilles is hurting, a bunch of other problems. So I started injecting myself, and indeed there was an effect. I started then with my mom and my closest friends and patients, and eventually opened it up to a more general practice. Every time I talk to a person, I get a pretty complete history. When I see them, we do a limited exam, and I take pride in customizing therapy. So it's very rare that a person will only get one form of treatment. Here's my second patient, and indeed this is the afternoon after her first injection. I said, Mom, how do you feel? She said, I look younger. I didn't know what she meant, so I drove up to see her, and indeed her energy, her level of inflammation, fatigue was totally different. So now she's 82. This is her enjoying her first empanada, and she did look younger. And since then, she's gotten, I think, at least 11 or 12 treatments. I've treated over 100 people now in 300 different locations, and my experience is growing. And if you want, you can subscribe to this newsletter, and every week you'll get the replay of the webinar in case you missed it, and any other insights that we might have. I also have access to the most experienced doctors in the field, both scientists at the two major exosome companies and all the founders, as well as the clinicians who've done the most. So we're always helping each other and always learning. I think what is really hard for people to grasp is old versus new paradigms. You know, there was the Newtonian model, you know, then there was the Bohr's, or Niels Bohr atom model, and quantum mechanics. Everything kind of replaces. So the ideas are good, they can just be made better. In our high school science, we knew all about, of course, the nucleus and the endoplasmic reticulum. These are making proteins, and they're sent over to the packaging center, like the FedEx distribution center, and they're packaged into these bubbles with little tinier bubbles in them. This is the way cells work. But unfortunately, this textbook said, oh, it just kind of extrudes it out into the bloodstream. Well, that might not be the case at all. In fact, most proteins are not just hanging free in the bloodstream. There are proteases to destroy them. It's not a very good way to get a letter to New York, just, you know, throwing it out there. You have to package it and protect it. So they take these little tiny vesicles, as you can see in the bottom left. And again, there are many bubbles in a bigger bubble. The bigger bubble, yes, extrudes, but the tiny bubbles are still protected. And this is exactly what's seen in this electron micrograph. Tiny bubbles extruded into the serum, not free proteins. I like analogies. I like to shift analogies. So people ask me, you know, well, if the stem cells specifically, but all cells, in fact, are like the chickens. The chickens lay the eggs. We just need the eggs for the message, right? Here are the eggs, the little exosomes. So all multicellular things communicate in this manner. Plants have exosomes. When you drink cow milk, it has exosomes. Exosomes are the way that cells communicate in most cases. When we look at the size, it's important to get perspective here. Of course, we're down to the Planck length down here and up to a small amoeba. The biggest cell in the human is the egg, 100 micrometers. Most cells are between maybe 10 and 50 micrometers. So the size of an exosome is about 100 nanometers. So we're talking about 500 times larger. Okay, so the exosome comes from something that is 500 times larger. And for those who are interested in coronavirus, of course, the coronavirus is packaged in the same way as the exosome, so it's the same size and shares a lot of similarities insofar as it is a lipid bilayer sphere with RNA inside and some proteins. The other way that, oh, sorry, let me go back here. So the main way that stem cells work is by altering the behavior of those cells. They change the milieu, they change the phenotype, the programming, the epigenetics. I know there's a lot of fancy words there, but we used to think that stem cells went there, became what they need to become, which they do in fact do, but perhaps their greater mechanism of action is by orchestrating and conducting what needs to be done in that local environment. In fact, I think the most interesting thing in the literature over the last really only 8 to 12 years, people are realizing that if you take exosomes from a diseased person, whether it be kidney disease or cancer, those exosomes are bad. There's something dysfunctional. In fact, you can take the exosomes from the serum of a person who's succumbing to breast cancer, put it in a normal woman's breast, and that normal woman's breast will become cancerous. So exosomes are not all created equal. And this has tremendous implications. If you have a person who is curing themselves of hepatitis C, of course, you would favor exosomes from there. Just like back in the day when you got an unknown infection, they would give you pooled gamma globulin because they're hoping that the herd has some kind of immunity that you can benefit from. Well, same thing with disease conditions. People who are, again, shown in animal models, if you have an animal that is succumbing to liver or kidney disease, you take the exosomes, you can have a bad effect. And conversely, if you have someone that is overcoming those, good exosomes can have a good effect. This is a great picture. You can see exosomes tiny, tiny little bubbles. And what we're seeing here is blue and purple tags. There are three known markers on the surface of exosomes. They're 9, 63, and 81, which happen to be multiples of 9. So if you tag those CD9, in this case, 63 is blue and 81 is purple, what you see is, yeah, these, by radio labeling with antibodies, are the real deal. These are exosomes as we know them. So what is in an exosome? We have proteins, which is like the gas, go, go, go. An effect is given to the cell that absorbs them. We have microRNA, which are the brakes. In other words, there are these specific RNA sequences that will bind to a messenger RNA and gum it up so it can't be fed through and read. Okay, very important. And then perhaps the most important is the messenger RNA itself, which is like a clutch, if you will. Why do I say that? Well, a clutch shifts gears, so you can go up to 7, 8, 9 gears, but think of it as like, 100 gears, or it's really a force multiplier, as you'll see in a couple of slides. So when you give someone a messenger RNA, you're not only teaching them to fish, if you will, you're giving them a fishing boat. So they're like songs in each exosome, a bunch of notes, motifs, harmonies, if you will. And when you talk about songs, they come from many different genres. They produce different kinds of dance. Their musicians have different skills. So this is the point I'm trying to bring home from different angles, is that exosomes are not all the same. And of course, the exosomes from the old lady whose stem cells wouldn't copy enough so she could get her own transfusion, they were old. They're like these old guys back down here. So the quality of the cells determines the nature of the music that's being produced. As we're winding down the lecture, I put the eggs up here to remind you, there was a hit piece put out by one of the competitors of Chimera, and it said Chimera exosomes have nothing but normal saline in them. Well, that's completely true. But you have to realize, if you suspend eggs in normal saline, all you have when you test them is normal saline. So what you have to do is crack open the eggs. And indeed, the only way, this is one of the first questions I asked Duncan, is how do you know what's in them if they're protected? And he said, well, you have to use a detergent to dissolve the lipid bilayer enough so as not to compromise what's inside, and then do proteomics. Now, proteomics is a word like genomics, which is a study of the gene expression. Proteomics is a study of the protein expression. And here's just a list of some of the exosomes that are in their amnio product. You can see it's quite different from what's in their mesenchymal stem cell product. And this is a non-random distribution, obviously. So these musicians, or MSC stem cells, they are producing notes for a purpose. And that purpose, generally, the reason we choose MSC and not other types of cells to take their exosomes is because these are directed at reducing inflammation and reprogramming and creating new vessels and regenerating. And I would be lying, and anybody would be lying if they said to you they knew exactly what these proteins do. You can look it up, you can try and figure it out, but really it's the combination of all these things together that produces their effects. If there's proteomics, there's RNAomics. I'm not sure how to pronounce that, but it's, again, the study of the RNA expression. So what we see here is a histogram, and we see IGF. This is insulin-like growth factor binding protein. These are a lot of the messages that are in the exosomes. Now, keep in mind, just as if you went to the supermarket and bought one of those children's toys with a little grab bag of stickers or toys in them, and those little bubbles, you maybe wouldn't get all of the stickers in one. But if you take a massive population of billions and you crack them open with soap and analyze, this is the distribution, generally speaking. Now here's why messenger RNA is more powerful. This is actual scanning electron micrograph. And here's one message, and it's being read by, I don't know, a couple of dozen here at least. And what's being shown here in real life is shown in the cartoon. In other words, the reading ribosome is spewing out one copy of the protein, but this message is being read simultaneously. So you're getting a bunch of copies. You're not in fifth, sixth gear, you're in gear 100. Remember the old Clara pianos? These rolls will play whatever you want. So that's kind of what we're talking about with the exosomes. They're player piano rolls being fed into your Even albeit old or damaged player piano, it might be able to play the song that you want. So what do exosomes do? We focus on the MSC cell again, because these are how our body repairs. We have in all our vessels these MSC stem cells, and when there's injury, they will either differentiate, they'll migrate, or they'll produce exosomes. So the main mechanism is not engraftment, probably. It's clear that from my own experience, from people I talked to who've done stem cells, the results can be mixed, mainly because when you take off-the-shelf allogeneic stem cells, your body does its best to destroy them as foreign. Within 72 hours, most of them are probably gone. Hence, they're not producing exosomes anymore. And if we take the typical liposuction procedure, whether you do it in the US or you go to Panama and they do collagenase, they expand it, again, you're talking about older, damaged stem cells. You're not talking about newborn placental ones. So you kind of have a rub either way. You get a newborn placenta, but then your body destroys it. You get your own, but they're already damaged. So the key, as we looked to in the earlier slide, is that it's from young newborn placental MSCs that is the key. They have the best signals, the best music to get your cells dancing. And hopefully they can regenerate your dormant or dysfunctional stem cells. This is one of the last slides. I wanted to remind you that in my journey, I realized that there's really only one disease with many faces. So this is a diagram from my book that was adapted by one of the telomere testing companies, Lifelength. And at the center is this engine of shortening of telomeres, which causes DNA damage in a very well understood manner. And then that causes either senescence, which is a surviving dysfunctional cell, or apoptosis, which is death. And death leads to depletion. So if this happens in the brain, you can get Parkinson's, dementia. If it happens in the ears, maybe sensory neural deafness, eyes, macular degeneration. It could be we're just looking at one disease in many different stem cell types. Of course, depletion, dysfunction, inflammation, they lead to bad behavior. It leads to aging. And again, that's what we see in the diseases of older age. People have tendinosis, rotator cuff, they have tennis elbow. These are not inflammatory conditions, hence steroids often make things worse or cause atrophy. Same is true of the knees. When I went to my ultrasound webinar, I was talking to a rheumatologist who said, oh yeah, it's always kind of straw colored from the knee. It's dead, there's no inflammation. It's not a hot zone, if you will. It's because these organs that are damaged from aging and use, they've already copied so many times they can no longer copy. So they're burnt out. So again, one disease, many faces. I want to remind people that people in general intuitively think that lifestyle genetics play a bigger role than they do. I beg to differ. You can see a 16-year-old person who doesn't have a good lifestyle, have good genes, and they're fine. It's really more like a car. If you have a brand new Fiat or Yugo off the lot, it's going to be fine for a while. If you have the most reliable car, Toyota Camry, Honda Civic, and you run it for 500,000 miles, there's going to be problems. So if you want to do things for free to maximize your car maintenance, then pick up my book, The Telomere Miracle. It explains about mindset, sleep, breathing. These are the big engines. So we all accumulate damage through life, tendinosis, sterile arthritis. But then when that cell death is occurring and that dysfunction, not only do we have a bad exosome signaling milieu, but we have inflammation, and perhaps that even triggers more autoimmunity. So this whole cascade of events leading to aging, disease, dysfunction is something that is inevitable, and it's a function of mileage. Of course, using telomerase activators like I have, we can maintain, that's one aspect. I talk a lot about this Hindu Trivurti, which is the 3 forms. So we used to have just the Vishnu, the maintenance, right? Keeping you sort of young, maintaining. The second is destruction of Shiva. And there's something called FOXO4-DRI, which was, at least in animal models, shown to destroy preferentially damaged cells in a mechanism that's very beautiful and well understood. About 3 weeks ago, one of the companies in Senolytics, Unity, reported negative results, which is unfortunate. But the third dimension we now have exosomes, which is Brahma, or creation. We can actually take the exosomes from a young person, introduce them to our older self, and start to recreate and regenerate. This will be the last slide, and it's just a reminder that the FDA approval may come soon. A gentleman was talking about a submission, and it's true, about 2 weeks ago, they submitted to the FDA for COVID-related diseases and exosomes. But remember that the broader uses of any therapy are up to a clinician to decide. So it would surprise you perhaps to know that steroids have never been approved for epidural lumbar injection, yet it's standard of practice. This is an example of off-label usage. When we look at the ethics and the testing around animals, and in some Asian countries, there have been more advanced studies of people doing anecdotal case reports, small studies on treating diseases. But the whole pipeline in the US, of course, is more conservative and skewed towards intellectual property rights. But yet, I believe there are reasons to think that this technique will be effective and safe. It is, after all, from newborn babies that are free of infection. It's a universal language, and it should have universal transportability or portability to our older selves. I have to assume that Dr. Sheldon Jordan, myself, my mom, and my first 100 patients are not confabulating. It's not all just placebo effect, and that the changes we're seeing are based in some kind of physiology. I think that the future of medicine, if it's allowed to evolve this way, will be good. Of course, when we consider the forces of money and politics, intellectual property, and governance, we run into a problem. And what I don't want to happen is a situation illustrated in this mashup here. This is the ethanol molecule. It's pure ethanol, 200 proof. And so it would be possible to put ethanol in an exosome and call that a wonder drug. Same with any other of those dozens of mRNAs, VEGF, vascular endothelial growth factor, PDF, derived growth factor, all these other things. I saw a Facebook ad for BDNF, brain-derived neurotrophic factor. People want to sell something they can own the intellectual properties. They say, well, I'm going to put BDNF in an exosome and call it brain force or whatever, brain juice, and I'm going to spend $80 million to do a clinical trial for Alzheimer's, and then I'm going to make $80 trillion. That's kind of the game. But we're in a situation where every day we're getting older. We need help. If this stuff works, why would we ever want to re-engineer something brilliant? Allegedly, Chateau Lafite Rothschild is a brilliant wine. We could go and say, well, it's 80 to 90% Cab, 20% Merlot from year to year, 0 to 5% Cab Franc and Petit Verdot. I mean, does that really tell you what it tastes like to drink this wine? Not really. And what does it mean to be Cab? I mean, that is broken down to many sub entities. So right now we have a situation where, as long as we don't advertise or make disease claims, we have something that is from a newborn healthy baby that can talk to our cells and repair. And that's a beautiful thing. In the future, if things go as they often do, a big company will try and patent it and kick everyone else out. And they'll just put a couple of little things in there and call it Chateau Lafite, when it'll only be 2 or 3 things in their own cocktail. And that's unfortunate. But we'll see how the politics of all this plays out. All right, thank you for attending. I apologize for all the technical glitches. Webinar number 2 next week will be glitch-free. Learning curve is steep, but we got it. And so I appreciate all you coming. This is not where I live, but it's kind of similar. And next week, I thought we should talk about back pain. We've had a lot of good responses, maybe not total resolution, but back pain is something that is nearly ubiquitous and very complicated, and something that is well worth talking about.